Good morning and welcome to Tuesday Tooth Talk. I'm Dr. Kuiper, and today we're going to talk a little bit about the connection between dentistry or your oral health and pregnancy. So pregnancy causes a number of changes in your body, hormonally, physically, and those things all do have an impact on your mouth as well. So typically what we see is in your mouth when you're pregnant, there tends to be more inflammation in the gum tissues, more sensitivity with the teeth, and those tend to be corresponded to the hormone shifts and fluctuations that happen during the stages of pregnancy. So doing your best to kind of maintain good brushing and flossing will minimize the amount of gum bleeding and inflammation and soreness that you have, but some of that unfortunately just have to kind of make it through day by day. Along with that, if say something came up, a cavity that needed to be filled, or tooth breaks, need a crown, whatever it might be as far as dental work goes, we typically try and avoid dental work during the first trimester. So those first critical weeks and months where the baby is forming a lot of the central nervous system, heart, lungs, things like that, we try and avoid. Just there have been studies that show that there really isn't any impact there, but we'd rather be safe than sorry. The second trimester is actually where we would really encourage dental work to be done. So for those of you who need a cleaning, who need any of that dental work, that's kind of the sweet spot, because the baby is done developing the basic structures that are there. They're just getting bigger during that second trimester time. But you're not into the third trimester, where we're not worried about causing any harm or damage to the baby, but just laying back in a dental chair in the third trimester, probably not the most comfortable thing, sitting there with a bowling ball in your stomach. So the second trimester is where we really encourage people to get in, make sure that you're still getting your routine cleanings, you're still getting your work done. There's no higher risk to you or the baby to have all that work done. And it still keeps you on track so that you don't end up, after the baby's born, realistically, there's probably going to be some changes in life once that new baby comes. And things tend to get put off. So we don't want to end up having it be a situation where you're regular with all your care, and then pregnancy and the baby happen, and it becomes 2 or 3 years before we see you. We've seen that quite a bit, and then that's where you get into problems where there are some other issues with the gums, or the teeth end up with quite a few cavities. And that's mainly just because of the time that's elapsed since you've been in to see us. So please don't feel scared to come in and see us. If you are pregnant, it's still important to have all that oral health taken care of, particularly because some of the bacteria that are in your mouth can definitely get down to where the baby are. We just want to make sure you're safe and healthy. So if you have any concerns, please give us a call. We'd love to talk to you about it, and enjoy the rest of the day.